Welcome to Working for Women, the Independent Women's Forum podcast, where we are changing the conversation about women and public policy for the better.
Hello, I'm Hadley Heath Manning, Director of Policy for Independent Women's Forum, and your host for today's Working for Women podcast. Today, I'm joined by a very special guest, Grace Marie Turner, who is president of the Galen Institute. It's an organization that is just critical to shaping healthcare policy, and Grace Marie has been a very influential player for years in the debate over health policy in Washington, D.C. So thank you, Grace Marie. Thanks for joining me today.
Well, thank you, Hadley, and I'm delighted to join you on this call and for your upcoming summit.
That's right. I've asked Grace Marie to come on our podcast today so that we can do a little preview. Grace Marie is going to be speaking with Katy Talento, White House Special Assistant to the President for Healthcare at IWF's upcoming Women Lead Summit, which is on May 9th. And so Grace Marie and I will be talking a little bit about healthcare policy and specifically about the role that the administration and the White House have been playing. So my first question for you, Grace Marie, is what do you expect from this conversation that you're going to be having with Katy Talento, whom I mentioned is a special assistant to the president?
Well, and she has a long background in health policy, and both on Capitol Hill as well as working. She was one of the first people to serve the Trump transition team and campaign on health policy. So she's really well versed in these issues. And there are so many issues on the table, from prescription drug prices to the opioid epidemic to the improving the quality of care, access to care, with so many people struggling to afford health insurance. And she, I think, also will talk about and is very interested in some possible activity and action this year on giving people relief from the costs and restrictions of Obamacare.
I think that point is going to be very interesting to a lot of our listeners because, of course, we all watched very intently as Congress debated some serious reforms on health policy in 2017, and that was not a success ultimately. What do you think is in store legislatively? Is there anything that we can hope for this year, or are you primarily hoping that the administration can take some steps on the executive side to offer Americans that relief?
Well, the administration is doing a lot on the executive side. They're doing, they have a rule proposed on creating association health plans. They are proposing short-term limited duration policies that people rely on for transition coverage to be extended to a year rather than the 90 days that the Obama administration limited to, which is pretty useless.
I know another issue that you mentioned, Grace Marie, at the top of this podcast is prescription drug prices. So can you give us a little background on that issue? It seems to be an issue that we constantly hear politicians talking about, whether it's Bernie Sanders or, Hillary Clinton, Donald Trump. Everyone who was running for president in 2016 said something about prescription drug prices, unsurprisingly, because, of course, this is something that many Americans struggle with. What has the FDA or other agencies under the Trump administration, have they done? Have they taken steps to address this? And how would you rate their approach to prescription drug prices?
Well, the left pretty much has a very simplistic view of just, put price controls on prescription drugs. Certainly, that may, in the short run, be able to lower some drug prices, but it's a very complex issue. And I think that prescription drug prices are often sort of the lead of people are most exposed to the prescription drug prices because their co-payments may not cover some drugs, and you wind up with a $1,400 co-payment for a drug you need. It's crazy, when other insurance would cover those costs. So there really are a lot of distortions in the insurance coverage of prescription drug pricing, and I think that the FDA is trying to work with that, also CMS. But ultimately, the Scott Gottlieb, who's the new head of the FDA and very, very knowledgeable both about the industry as well as about the innovation that's required, so that we can't just say we have all the drugs we need and shut down the research, which is what price controls would do. It would really cripple the research effort to produce tomorrow's new drugs. So they are really trying to walk this fine line between having prices that are more reasonable, making sure insurance covers these high-cost drugs when necessary, but also making sure that we speed up the pipeline so it doesn't take 12 years and $2.5 billion to bring a new drug to market. So they're working on a lot of different fronts to try to help lower prices. I think transparency about where the money is really going and who's gaining from the discounts that the companies have to offer also will be helpful. So I think that the Trump administration is taking a much more reasonable approach to what really is a very complex problem. And I think Katy will be able to talk with us about in more detail about what the administration is doing on that front.
That's good news, both for today's consumers of prescription drugs and also for those families. I often think about, my husband is in pediatrics, and I often think about what would it be like to have a child with a disease for whom there's not yet a cure. So that innovation piece is very important. And on a related note, while we're talking about drugs, one of the issues that, at least if you listen to President Trump and if you watch what he's tweeting about and seems to be focusing on throughout his time in office, the opioid epidemic seems to be a major focus of his. So what would you say about how the administration has been working to reduce opioid abuse, and also the other side of that, while we're talking about balance and drug policy, also ensuring that those patients who maybe do have a legitimate need for opioid drugs have access to those things? Are we seeing some progress on the opioid epidemic? Is that something that you plan to ask Katy about?
I do plan to ask her about it. In fact, the White House held a conference call yesterday for a number of health policy people around the country to update us on their commitment to address this problem. About 100 people a day are dying from opioids, almost as many as people as die from car accidents. And it's something that the administration is very focused on. It's something that the president saw when he was campaigning was an issue at the state level, and they're absolutely committed to addressing this. But obviously, a lot of this requires legislation from Congress. The Congress did include some money in its omnibus spending package earlier this year for opioid treatment and addressing this problem. But it's also a very local problem. One of the things we've learned from Obamacare is how difficult it is for the federal government to impose a solution on something as local as healthcare problems. And so devolving power to local communities to address these issues, I think is going to, and obviously with some resources, obviously is going to have a bigger impact than one federal solution, which is probably going to be one size that fits none. And I think the White House recognizes that, but they also understand the importance of the White House talking about this and recognizing this is a serious problem for our country that we need to address and we need to put resources behind, but that we also need to recognize the importance of local communities in addressing the problem.
Well, that sounds like a smart approach. I have one last question for you, Grace Marie, and I know that at Women Lead, at the IWF Women Lead Summit on May 9th, you're planning to speak with Katy Talento, who works in the White House. But there has been some progress on Capitol Hill. There have been at least two major changes to the Affordable Care Act, and I'm not sure that these events have gotten all the attention they deserve. Of course, people know about the change to the individual mandate penalty, and that's something I'd like to hear your perspective about. But also, we know that Congress has effectively repealed the Independent Payment Advisory Board, which is a piece of the Affordable Care Act that I think a lot of people may not know much about. So can you explain to us what those two changes mean in terms of, what does this mean to everyday people in the United States, that the Congress has gotten rid of this board that functioned within Medicare, or was intended to function within Medicare, and also that they've removed that penalty for going without the government approved insurance?
Yes, well, and I think that the individual mandate, the federal government's requirement that you purchase health insurance or pay a increasingly large fine was always the most unpopular part of Obamacare, and that there was a lot of competition. So that is essentially null and void. The fine is eliminated starting next year. But there was another provision in the law, and actually my colleague Doug Badger and I wrote a piece about this in the Wall Street Journal last summer, that we really felt certainly should be challenged on a constitutional basis, because it gave this appointed board, this unelected board, the power to set prices throughout the Medicare system that most private carriers wind up using as a benchmark for their own payments. And it would have usurped congressional power. It would have usurped judicial authority and to review this. And we really felt that this was a really a bridge too far in trying to control prices in Medicare. And so the Congress wisely just eliminated the board before a single person was appointed to this board. So that's a victory, I think, for our constitutional process, and something that we can thank Congress for. They've also delayed some taxes. The medical device tax has been delayed, the health insurance tax, Cadillac tax, and we've also seen, in addition to the administration action that we talked about earlier on association health plans and temporary health plans, there also have been some waivers that have been approved, like the waiver in Iowa for people to purchase health insurance outside the Obamacare mandates through the Iowa Farm Bureau. Basically, they just don't call it insurance, even though it walks like a duck and talks like a rock, and it, otherwise is insurance in every other definition. But our Iowa Farm Bureau can offer policies that are not Obamacare compliant and allow people who've been shut out of the market to be able to afford to purchase health insurance. And so I think that's another important development. There are a lot of different things happening, but I do think, to come back to our earlier conversation, I do think that we can look forward to the possibility that Congress is going to come back to a major restructuring of the Obamacare health insurance program to once again take so much power and authority away from the federal government, which has really basically decimated the individual markets for health insurance, and return that power to the states so that they can provide health insurance that people want and actually would be able to buy.
I'm sure many of our listeners look forward to that with great anticipation. I know I do. I would love to see, more affordable options in health insurance, and, a better way to make sure that all Americans have access to higher quality coverage, and also at a price that suits their budget. So I know those have been ongoing problems under the Affordable Care Act, and I look forward to the day when Congress can address those things more comprehensively. But I do think it's sort of a myth that nothing's been happening on the healthcare issue under President Trump. In fact, it sounds like from our conversation today that there's been, action on Capitol Hill and a lot of action through the administration. And I really appreciate you taking the time to explain some of those things to us, Grace Marie.
Well, thank you, Hadley. And, women really are the decision makers about health care and their families. And I think that this conference and this forum will be particularly interesting to see what possibilities lie ahead to really give people relief, and also make sure they get good quality care, but that they have access to the coverage they need for themselves and their families. So thank you very much for this opportunity, and I look forward to the May 9th conference.
Thank you so much. I've been talking with Grace Marie Turner, who is president of the Galen Institute. Grace Marie, can you give us the Galen Institute website?
Yes, if people can visit us at Galen, GALEN.org. And we also have a sister website that we maintain called ObamacareWatch.org, where people can stay up to date on everything happening with action on this front that we've been talking about on Obamacare. So ObamacareWatch.org and Galen.org. Thank you, Heather.
Thank you. Thanks for those resources. Grace Marie is going to be speaking with Katy Talento at IWF's upcoming summit in Washington, D.C. on May 9th. It's our Women Lead Summit. Katy Talento is a special assistant to the president for healthcare, and I'm sure the two of them will have a wide-ranging and in-depth discussion about what's been happening in health policy. So thanks for joining us and giving us this update, Grace Marie. And for those of you who tuned in to listen to our Working for Women podcast, thanks, and we'll see you next time.
If you enjoyed listening to this podcast, please give it a thumbs up, share it on social media, or stop by IWF.org for similar content.